Welcome back to Rohrich Knows Podcast, helping you become a better and more informed you. I'm Rod Rohrich. I'm a board-certified plastic surgeon in Dallas, Texas, and we're going to talk today about some hot topics with my favorite dermatologist, Mary Lupo. How are you?
I'm great, Rod. Good to be here.
It's great to be here, and she's here in person. You know, she's been on my podcast before, but she came to Dallas as a special trip, and we're going to talk about some hot topics. Let's start with Korean skincare. It's like the bomb. Everybody's talking about it, and you know, it's like the porcelain skin. So, I mean, first of all, your skin looks beautiful. So tell us about what's.
And I'm not Korean. Isn't that amazing?
You're Caucasian.
So, you know, because of social media,
Right.
Things are self-feeding.
Of course.
And the more things are talked about, they trend.
Right.
So people want to talk about them,
Right.
so that they can get in on the trend.
Right.
So I do think that the South Koreans are excellent at making cars. They make great lasers, and they have very good skincare.
Right.
The skincare that they have, I sometimes scratch my head because there'll be people who'll post, and they'll do a post, say, on glutathione.
Right. Like glutathione is the bomb.
Like it's new, and it's not. Glutathione has been around in science since the late 1800s. I believe is from yeast, some yeast extract.
Yeah.
And it's 3 amino acids, glycine, cysteine, and glutamic acid. And it is a very, very good antioxidant.
Yeah.
And we have talked about it in dermatology for years.
Is it better than vitamin C?
It's an alternative. Better. You know, the problem with vitamin C is how is it made? What is the formula? Because
How's it
the
absorbed?
stability of ascorbic acid is very tricky.
Right.
And in fact, probably, let's say, the most popular and well-known vitamin C out there, which is an ascorbic acid, has to be stabilized at a very acidic pH.
Right.
And you'll know as you use that product over about a month's time that it turns colors. And once it's turning orange, it's not bioactive on your face.
Okay.
So, and the other sort of bad thing about ascorbic acid is you are extremely limited as to what else you can use on your skin, because the acidity, the pH, will break peptide bonds. So if you're using a peptide and an ascorbic acid, vitamin C, that peptide is being completely destroyed
When you put vitamin C in. Okay.
when you use both at the same
Well, I
time.
didn't mean to divert you from the beautiful glutathione and the
So
Korean
that's just an
skincare.
example. The real strength of the message of the Korean skincare is you've got to realize that different ethnicities age differently, and they have different goals in
Right.
how they want to age. And Koreans don't wrinkle.
Yeah. Well,
Their
Asians, yeah.
their issues from a plastic surgery or a somewhat invasive point of view, they're sinkers. They'll sink in the medial cheek typically, and they'll get heavy in the masseters, and they have those kind of changes, but they don't have a lot of wrinkles. But
Right.
what they do value is a whiter skin.
Right.
What's interesting is that's not a big value in the United States now.
Yeah.
Even skin tone is valued, but people don't want to be whiter. They want to have their natural skin tone.
Right. But I mean, they call it porcelain.
Porcelain,
I mean,
yeah.
it's kind of.
Well, it also alludes to the fact that what they put in their products, besides like a glutathione, is arbutin is a long used product.
But what is that?
It's an anti-melanogenic. It inhibits melanogenesis.
Okay. So
it's sort of like an alternative to hydroquinone.
Hydroquinone.
Because you can't get hydroquinone in Asia. In a lot of places, you can't get hydroquinone.
Right.
And so arbutin is an option, kojic acid, and so they like arbutin, they like glutathione, they love hyaluronic acid,
Right.
which is a superhydrate. When you superhydrate the skin, you're going to get a temporary minimization of your pores. And the reason for that is when you swell the corneocytes on the top layer,
the pores.
you will minimize the appearance of the pores. So they like poreless, lighter, skin. That's what they like, and that's great. And just we as physicians here in the United States, the beauty of being a doctor in the United States is we really do learn how to treat all ethnicities.
Right.
We have a very, very diverse country, and we have to know how to take care of, let's break it down into Asian,
Right.
African American,
Caucasian.
Caucasian, of course, Western European specifically, Hispanic,
Right.
and let's say probably Eastern, Middle Eastern, Indonesian type skin.
Right.
So, but we know how to do that. And we know how to customize both the skincare and the treatments to accommodate the unique needs of each of the skin types of the different ethnicities. So Korean skincare, it's all about hydration, and
Which is good. We use it a lot.
Of
we
course.
We love HAs.
of course.
Yeah.
Well, HA is such an innocuous product.
Right, and it's a
But
moisturizer.
remember one thing though, if you're using hyaluronic acid in an area that has very low humidity,
Yeah.
and it can't pull water from the atmosphere,
Right.
you better make sure that you've got a mist of water on your face before and after you apply it.
Okay.
And preferably at night, you seal it in with some sort of emollient that's a little bit heavier, or it may even suck the moisture from your skin to the surface. So you really want to make sure that your skin is well hydrated, and use the hyaluronic acid to lock it in a little bit better.
Okay, good. So those are the three main differences.
There's a lot of botanicals in the Korean line. If you get any particular product and you read the ingredient list, it's like you're walking through a botanical garden.
Now, is that good?
The
smells
benefits
good, right?
of botanicals are they're natural, but they can, in some people, be allergenic. So you do have to be careful. And the thing with skincare is everybody just needs to take a deep breath and realize that skincare is something that is a very long-term commitment for you
Right.
to really see meaningful results, and it involves consistency. And I know you want to talk, and we should talk about the fact that there's how do you do a skincare program,
Right.
so that you're not spending 45 minutes in your bathroom at night.
That's right, which we'll talk about
Yeah.
in the next podcast. So the take-home message for the audience on Korean skincare, because it's so hot. Every time I look at TikTok, or they say, "Oh, this is the secret ingredient." The take-home message is
None of these are new. None of
them
these
are new.
ingredients are new.
None of them are
No,
new.
I think, they may be combining them in a new way. And in general, I actually, in preparation for this, I actually bought a couple of products so I could feel them and everything. And I think people do need to be prepared. People in the United States typically don't like products that are sticky, and some of them are sticky.
Is that because of the botanicals in there?
No, I think it's because how it's formulated to stay more on the surface of the skin. So a lot of people really like a product that you put it on
It just-
and your skin drinks it in.
Right, and it's invisible.
And it's
Yeah.
going to work.
Right.
If it's just sitting on the surface, remember the surface of your skin, that top layer of skin is not viable. It's dead.
Right.
Those are dead corneocytes. So, it's great if it makes you. They're not very expensive.
Right.
So it doesn't cost a lot to play around and see if you find something you like.
Okay. So what about the people that go to Seoul and then have like 13 treatments of skincare, lasers, radio frequency and neuromodulators all at once, and then they come back and that actually to me makes no sense, but it's kind of like a wow. So is it kind of a bad wow? To me, it looks like it's not a good thing to do.
Well, you got to be careful. So I think a lot of people do that because all these procedures are less expensive there.
Yeah.
And so they'll bundle and they'll pile on.
Right.
So what would not be an unreasonable, let me tell you things I would not do the same day.
Yeah.
I would not do a neuromodulator when I am doing any laser procedure
course not.
that is going to cause edema, and you're going to have diffusion of that toxin who knows where.
Exactly.
So, but can you do fillers the same day as lasers? So yeah, you can. And can you use multiple lasers on the same day? Absolutely. One of my favorite combinations, and I've told you this, is I love to do either an IPL or a vascular laser, do a pass of that, and then follow it with a light ultra clear.
Ultra clear.
That's one of my favorite combinations. Now, a lot of people will layer things like Thermage and Fraxel.
Okay.
You always want to do the procedure that does not disrupt the epidermis first.
Right.
Because when you do Fraxel and you do ultra clear, you're disrupting the epidermis
Right.
to an
And
extent.
do that
You want to
last.
do that last.
Yeah.
So those would be the takeaways. Another question I often get is, ooh, is the laser going to melt my filler? And the answer is no.
No.
I mean, you've got to get to at least 65, 75 degrees centigrade to get melting of a
And
hyaluronic. You ain't going there, okay? You'll be melting the face before you melt the filler.
All right, that's great. That's great. So the Korean skincare, it's a hot topic. It's a fad. Not much really new. It's just how they combine it and put it together. And I think, Mary, you bring up a really good point. I mean, every ethnicity is different. You can't just say this is good for your skin. And you're right. And in the U.S., I mean, we are a very diverse population, and especially in the South. I mean, we are very, very diverse. So we have to, everybody's treated different. It's kind of like a facelift. You can't just do the same thing on everybody. So same with skincare. So I think so what are the three take-home points for the viewer when they're thinking about all this Korean skincare stuff? What should they do when they go to see their dermatologist or plastic surgeon? What should they ask
Well,
for?
you can, if you would want to print the ingredient list for your dermatologist to look at, to see if your dermatologist had any pressing comments, see if there's any problem with any medications topically you're already using or other skincare that you're using. Remember that the single most important thing to use on your face still remains a sunscreen every day.
Right.
And and there's no easy way, left to its own devices, we don't age well. You have to be doing something all the time. And I mean, I look at you. You look better than you looked that I saw you last time.
I don't know about that. It's the light.
No. I saw you in the back and you look good.
Yeah.
I suspect you've played with one of your new lasers.
No, I've just been using retinol and plated. I've been using plated.
We love our plated skin
Plated.
science,
Good.
don't we?
So
Both
what
of us.
about, one last thing before we leave Korean skincare is they kind of poo-poo retinols a little bit.
Well, but listen, there's a lot of science behind retinols.
Oh, no.
Okay,
I know.
So, I would, why people poo-poo it? Because they think it's passé. And they don't want to be saying the same thing that is heard everywhere. Unfortunately, on social media, you get brownie points if you say outrageous things, sometimes untrue things, and people get intrigued. Oh, well, this is a new take on this, but
Right.
that doesn't necessarily mean that the new take is correct.
That's great.
So there's a place for retinol. I don't use retinol myself anymore, but I did for 30 years, and now I've evolved into something else.
Oh, great. We're going to talk about that in the next podcast. So, wise words from an amazing dermatologist, Dr. Mary Lupo in New Orleans. So, helping you become a better and more informed view about Korean skincare. It's a lot more or less than you think. Until next time, stay informed. See you at the next Rohrich Knows.